on Facebook as well. This is HRB Breakfast, and it's time for the COVID update. Good morning, Dr. Seshni, and welcome to the show.
Good morning, Opoku. How are you today? Can you hear me?
Yes, I can hear you loud and clear.
Okay.
Can you hear me?
Yes, I can. Yes, very loud and clear.
Fantastic.
Yes.
Anyway, as I said yesterday, there doesn't seem to be a lot of, sensational COVID stories going around. But what we know for a fact is that the Delta variant is still spreading quite dangerously.
Yes.
What's the situation like in the past 24 hours?
Yes, so we're still seeing large numbers of the COVID increase, and as you said as well, there isn't that much changes apart from looking at travel, and the numbers increasing. So there isn't really much other discussion apart from what we've just been hearing about. So yes, it is spreading rapidly, and I think it's possibly because of the fact that we are in the summer months, as well as it's holiday time, and a lot of people are socializing, and also they are going around without masks, because obviously the rules have changed. So in the last 24 hours, as you asked, the figures that we have, I'm just going to give it to you now. So 44,104 new cases in the UK, with 73 new deaths. So obviously the numbers are going up. Yesterday it was 46,000 with 96 new deaths. So it seems like every day we are still seeing a large number of people. I mean, that's quite a significant number.
Yeah, absolutely.
It's not like it's 1,000 or 2,000 that's getting infected. So, it might be a case that, the tests are actually picking up that people are being tested positive, but this could be for so many different reasons. So it might be that even these people have a positive test, but does not necessarily mean that they are symptomatic or that they are having COVID, the clinical COVID. So it might be that, okay, yes, we are seeing numbers going up, but I think we need to take it into context, if you understand what I'm saying.
Yeah, I do,
Yeah.
Yeah.
And can I just say, so I think what I've read as well, I don't know, you probably have more information, but regarding people, using the NHS app, and if you're going into certain areas and the app is then pinging people to stay at home or isolate. So I don't know what your thoughts were on that, because I think that seems to be a bit of a controversy and some problem in some aspects for a lot of people.
Well, I don't know if there's something not right with the app or not, but it's from what we're hearing, there's a lot of pinging going on, especially with essential workers.
Yes.
And this is causing a bit of controversy.
Yeah.
Because some companies are still saying, "No, still come in," because otherwise there's going to be shortage of staff and all that. Yes. At the same time, people are not too sure if these people should go in to work, since they've been pinged by the test and trace app. I don't know what to say to that. I mean, I'm not an expert when it comes to this medical stuff, but
so I think, as I was explaining, with looking at the context in which we are seeing large numbers, people are testing positive, and then obviously it's now connected to the app, and obviously the app is then going to alert people. So that was the purposes of the app, to connect more people, to keep people more up to date with what's going on in their areas. And obviously, if there's any concerns, people need to self-isolate. So the whole concept has been really important and has been very helpful in the driving force of reducing the risk of people getting COVID-19, reducing the spread. So the whole concept, I think, is very it's brilliant, and obviously if it's effective in that aspect, I think it's really good to be notified if you are in an area where you could potentially get COVID, because we are all going out and about, and we're putting ourselves out there, and obviously we don't know who else is socializing in those areas. So in that aspect, it's very helpful. But yes, in terms of it pinging and then telling everyone to self isolate, I think especially during the summer holidays, not a lot of people are very happy. But it might be there's an issue with the app or with the testing. I'm not sure. But just I wanted to also highlight that, so obviously people are getting concerned with the increasing numbers, and there seems to be now a campaign. So I don't know. Yeah, we can probably discuss more, to socially distance and to wear a mask. So I'm not sure what your thoughts are on that.
Well, but that's obviously I think we should still adhere to those rules until we see zero deaths and zero infections, because it's still out there. And the Delta variant and other variants that are with us now, they're spreading quite quickly. So I don't see why we shouldn't look after ourselves, even though a lot of these restrictions have been lifted. Does not mean that we should just dive deep, and just go straight. I think we should just be careful as to how we go about things. The other thing I'm concerned about, that I want us to discuss, if you don't mind, is seeing in the news about panic buying.
Okay, yes.
It seems as if because it's been on newspaper front pages, pictures of empty shelves in certain shops and all that. And therefore it's sort of making people think that they should start panic buying. And we don't want to get to that stage where, like in the beginning of the whole pandemic, you remember in February last year, March and April, when people started panic buying, you couldn't get toilet rolls anywhere and stuff like that. We don't want to go back there, do we?
No, we don't. So I was actually, when you told me about panic buying, my sister in South Africa was telling me that people were panic buying in South Africa, but obviously that's in the context of riots, unfortunately, and the COVID pandemic, which makes it more difficult. But hopefully South Africa is okay and things are settling. But coming to the UK, yes, it's reminding us back about, we had adverts and campaigns where the toilet roll became quite important, where people started to buy lots and lots of toilet roll for some reason.
Well, what the toilet roll has to do with
I have
COVID,
no idea.
Nobody has any idea.
Up till today, I'm still yet to
Same here.
uncover the mystery.
Why? It's not as if you need toilet roll to kill the virus.
No. So yes, so it's understandable that people are obviously panic buying because they are concerned of the third wave. So this is the third wave, right? Am I correct in understanding it? I think we're predicting that this is now we're going to go through a third wave. And we're in the midst of it. And just to say, I think that I was talking about the pinging, that's probably linked to what's going on. So it's a Delta variant. So it's a combination of a variety of things. Obviously, the Delta variant, the other variants, the Lambda variant from Peru, the Delta variant from India, the variants from South Africa, Kent, the UK variants, and other countries like the Brazil. So they're also saying that the pingdemic, so it's because of the pinging, they've called it a pingdemic. Means supermarket supply chain starting to fail. So obviously, this is what they're saying, because what has happened is the pingdemic is now sending thousands of workers into self-isolation. So this is what the food industry's leaders are warning. So obviously it's causing panic and obviously uncertainty, because if you are being pinged and saying that you need to self-isolate, so it's causing people to think, okay, that there seems to be something going on and we need to isolate, and people are panic buying as well. So I don't know, what your thoughts are, because I think we should be reassured that we've gone through the first, second, third, lockdowns, and we've managed to have always had enough food supplies. So I think you're right, because when we went into the shops, actually, we went into the shops 2 days ago, and some of the shelves, like the shelves were literally empty. And this was like, I think 8 to 9 o'clock at night, where the shelves were like completely empty. So I think there is some truth in it, that it is actually happening, that people are panic buying. But is it
Yeah.
because of the summer? Is it people are just stocking up because it's summer, it's so hot, and we need
Well,
to rehydrate and
there's
have food?
there seems to be a suggestion that because of the pinging, when the NHS app is pinging a lot of essential staff
Yes.
so yeah, so the shortage of staff, and that is sort of connected to the shelves not being stacked, and then people are panicking now, so going, oh, what's going on? Let me just go and grab
Yeah.
what I can grab and all that. Well, that's how I understand it. I don't know.
Well, I think it's true, because now that we just started talking about it, I remembered. And I was surprised. I thought, okay, is it everyone stocking up for their summer holiday? Is that why all the food's just gone? And it was one of the
But
hottest
we
days.
don't usually stock up on summer holidays,
Well,
do we?
exactly. I
No.
wouldn't. I mean, we went shopping because we needed food, but it wasn't to panic buy. So
No.
just to clarify.
I went to
that.
Tesco yesterday. I
Okay.
got released yesterday from my
Oh, fantastic. well
from
done.
quarantine. Got released yesterday, and I said, "Oh, let me just step out." So
Yeah.
I went to Tesco, and I took Bridget to Tesco, and there was nothing untoward. It was just normal Tesco. Everything was there. The shelves were properly stacked and all that. So I didn't even think about it until I saw the news, late last night and this morning, and I'm
It
thinking,
is
oh, God.
happening. It
Yeah.
is happening. Maybe the Tesco that you went to, obviously, was definitely the shop that we went to a few days ago.
Yeah, I believe you. I believe you. I saw pictures of it, and I'm thinking, oh God, why are we panic buying now? It's taking us. I hope it's not taking us back into 2020, early 2020s, when things became. And then oh God, I remember one time we had to sort of, somebody called us from is it Farm Foods or Iceland? Farm Foods, I think.
Yeah.
Oh, they've got supply of toilet roll, and we had to rush there, go and get some toilet roll. That was crazy. But hey.
Yeah. I must admit that, with the practice I do, and I think what's going on as well, a lot of people are, sort of buying as well in order to prepare for any crises or any situations where they can't get enough food, or they don't have enough supply, or they cannot go out for some reason. Because obviously people have to self-isolate. You do need food in your home. You're not going to be able to go out. And if you do go out, you might be fined, or, you would suffer the consequences. So to be honest, when I did go shopping, so I wasn't panic buying, but I was buying extra certain things which I feel, okay, I can have these extra bits in the cupboard, where I can, have the supply in case it's needed. Because with the Sukhya Mahikari, we're doing a lot on crisis management and emergency preparedness, and preparing for emergency. So having extra food that you can put in, keep away. But obviously you have to check the expiry dates, and then also, packing emergency packs, so having like a bag with a mask, with some water, with a whistle, a torch, some money, and sweets if you're a diabetic person, especially. So just having emergency bags in the car when you go out, and also larger emergency bags in your home. So I think that's a good idea. So I'm glad we spoke about this, because actually in the context of panic buying, people can actually then now change the mindset and think, okay, let me plan. If I do need extra food, if there's a reason I cannot go to the shops, or I have emergency packs with me at all times, and also I'm able to stock up, my cupboards with extra food. So I think that's a way to maybe go about understanding what's happening. Yeah.
Right. Okay. Well, let's talk about hospitalizations.
Yeah.
So, is there any news on that?
No.
Is it increasing, or is it decreasing?
Well, there isn't really statistics on that at the moment, but just before we get into that, as I pointed out, people in England are urged to continue to wear face coverings in crowded places and use the NHS COVID-19 app to check into venues, despite legal requirements to do so being lifted. So the campaign, Hands, Face, Space, Fresh Air slogan with Keep Life Moving um, is still obviously being promoted. But in terms of hospitalizations, I don't think there's been any changes in terms of people being hospitalized. But what they're saying is that Patrick Vallance has said that 60% of all COVID hospitalizations are unvaccinated. So that's interesting statistics.
Vaccinated.
Unvaccinated.
Oh.
Yeah.
That's very interesting statistic, isn't it?
Yeah, it is. I think it is, and it then goes to show that people obviously that have not been vaccinated yet for various reasons, please do. It's a health disclaimer. Please do consult your doctor, your pharmacist, and your healthcare professionals. We are not offering advice and medical treatment, but just merely discussing what is the guidance and what is the preferred advice. But what Sir Patrick Vallance is saying that 60% of hospitalizations, so they said, are unvaccinated. So most of the people that have been admitted into hospitals for COVID-19 are the ones who did not have vaccination. So they said at least 36 million, 68% of all adults have had the second jab already, while 48 million in the UK, so 88% have had one jab.
Okay.
Yeah. So there's still about a third to continue to get both jabs, and obviously quite a large number have got one jab, 88%. So that's quite good, I think.
Yeah,
that's excellent.
And while we are on the subject of vaccination, what's the situation like with the younger generation? Because I know that the 18, the youth, they were invited to go get their vaccines, and a lot of them did go. What's it like now? Are they still going for the vaccine, or has it dropped? Do you have any information on that?
So they are saying that yes. So they are. So on the 19th of July, the ministers in the UK government announced that they accepted advice from the Joint Committee on Vaccinations and Immunizations, the JCVI, on COVID vaccination in children and young people aged 12 to 17 years. So they said that they should only be offered the Pfizer BioNTech, and it is authorized. This is the only vaccine that's authorized by the MHRA for 12 to 17 years old.
Is there any particular reason for that?
Yeah, because of the clots, they obviously will not give the younger generation, because we know that the AstraZeneca, because we know that we had people in the 20s, 30s who had been hospitalized and suffered complications as a result of, and obviously older people as well, as a result of the AstraZeneca. So they said the vaccine is authorized, but 12 to 15 years old who are increased risk of serious COVID disease and hospitalization in the following groups. So it's restricted to certain groups. So those with neurodisabilities, those with immunosuppression, with Down syndrome, and profound and multiple learning disabilities, severe learning disabilities, and on the GP learning disability register. So it's all the patients that I've specialized to treat. So all learning disability patients, and 12 to 17 years old who are household contacts of people who are immunosuppressed, those turning 18 in the next 3 months. So those that are 16 years of age as well are also advised. So they said that, so they've advised them that they can get it, but I'm not 100% sure of how many people have actually taken it up. So but that is obviously the news, that it is open. I mean, it's quite interesting, isn't it? Yeah. So they're saying, yeah. So I think what the information is that obviously 1 in 6 people, the youth are still reluctant to get the vaccine. So I don't think it's actually not open to everyone. So it's just yeah.
Okay. Now, quickly, let's move away from the United Kingdom and go to India, where it's a huge concern, because of the variants.
Can I just say one thing about children? They say the chances of children dying from coronavirus are so low that vaccines would need to be proven to be very low risk before they were given jabs, according to child health experts.
Okay.
Yeah, so it's only yeah, so it's because it's quite low. Yeah. Okay. Yeah, let's go to India.
Yeah, what's the situation like in India at the moment?
Yeah. So
we're talking about vaccination, talking about the spread and all that, and information on that.
Yeah. So at the present, COVID-19 in India, we know that they started to see an increase in the COVID spread a few months ago, and that was because of the Delta variant. And then we started to see the Delta Indian variant spread around the world. So as of yesterday, the pandemic has caused excess deaths in India to cross more than 4 million. So that's according to a new study.
Wow.
So it's quite a large number of people. So yeah, I think that's what it's saying, but obviously we haven't seen that figures on the world meter. So yeah.
But what's the vaccination situation like in India right now?
Yeah. Sorry, and just on those figures, they're saying that the according to the total that we've got on the worldometer, that is could be actually 10 times higher than that. So obviously the figures that we are seeing are obviously not accurate. Mucormycosis is a black fungus, which is another thing which was specific to the infection of the COVID-19. So it's an infection which a fungal infection which affected people's sinuses and spread to the brain, but is treatable with medication. But what they're saying is obviously it's still a concern. And as I said, so the vaccination, yes, as you were asking, so what they're saying is that they're actually going into the rural areas. So with fears of the new wave of COVID hitting India, pressure is on to vaccinate more of the population. So India is the world's largest producer of the COVID vaccines, and there's been criticism as to the rollout, but they are actually working very hard to roll out the vaccine. They're saying that the COVID-19 antibodies detected in 67% of the population, according to a new survey, which indicates how widely the virus has spread in the communities during the second wave. So they did a national survey which examined the prevalence of COVID-19. And so in the population of 1.3 billion people at Bogo, 67.6% of those have tested positive for antibodies. So as you know, as you know, you're an expert now about antibodies, but the antibodies means that the person either was exposed or had the infection.
Yeah.
So those are the cells that would be produced, the antibodies. So yeah. So over 60%, I mean, that's like 2/3 of the population. So that will give us an indication of how severe the COVID is in India. So, and obviously hospitalization continues because of that. Yeah. So, I mean, that's the main thing in India that's happening at the moment.
Anyway, our thoughts and prayers are with our brothers and sisters in India, and we pray that everything will get better. Anyway, shall we do the numbers now and then?
Yeah, we shall. Yes, our prayers and thoughts with everyone in India and all over the world, where we're starting to see an increase in the numbers, because obviously it is a concern. So let's go into the figures. I'm just refreshing the page. So the top, so in terms of the global figures in the worldometer, Okay, so the total number, according to the Worldometer, as of today, the 22nd of July, is 192,844,487 positive cases globally. Total number of deaths, 4,142,737 deaths. Total recovered, 175,361,586. Those that have recovered. So in terms of the top five, I think they remain this. They remain the same, with USA top number one, but they seem to be like standing still on those figures, with 35,146,476 positive cases, with 625,808 deaths. India 31,257. 31,257,720 positive cases, and they said there's been an increase of 881 cases. So not that high, but obviously still increasing, with 419,021 deaths. Brazil number 3 with 19,474,489 positive cases, with 545,690 deaths. Russia number 4 with 6,030,240 cases, with 150,705 deaths. And France number 5 with 5,911,601 positive cases, with 111,554 deaths. UK number 7 with
UK is number 6 now.
Oh, sorry, number 6. Yeah.
It's
Actually,
overtaking Turkey.
I know. I said that, and then I just looked because Turkey. It just switched. So it's UK number 6. Sorry, Turkey's gone down number, because Turkey was 6 yesterday. So UK's number 5 is 6. Sorry, with 5,563,006 positive cases, with 128,896 deaths. South Africa number 17 with 2,237,472 positive cases, with 68,192 deaths. And Ghana quite low down, with 99,160 positive cases.
Where is Ghana?
So it's 101.
Okay.
Yeah.
Yeah.
With 99,160 positive cases, with 815 deaths. So that's the figures that we are seeing. And in the past 24 hours, as I said earlier, with the UK, we have 44,104 positive cases, with 73 new deaths. So those are the figures. Just to say, I mean, the travel with France, are you on top of the travel, what's been going on with France?
No, I am not. I don't know. The last time I checked was yesterday, and there's still restrictions, especially from countries with high numbers of the Delta variant.
Yeah.
UK, for example, serious restriction. You go to France and you'll have to quarantine.
Yes.
And all that.
So they're saying that from the 18th of July, if you've not been vaccinated, you must present a negative PCR test less than 24 hours to be able to travel to the French territory if you're coming from the UK. But if you're fully vaccinated, you no longer have to present a test when you enter. And then the period of time you must wait following the final dose has been reduced to 7 days. So they do recognize Covishield as a vaccine to travel. And obviously, if you're a minor, there's needs to be accompanied by a parent. And French nationals will get a free PCR and antigen test at the airport.
And it seems as if France is they put in this this COVID passport thing in place properly.
Yes.
Yeah, you need it.
Yeah. So the COVID passport is going to be needed, I think, globally. Just
I
to
think
say
so too.
that people out that are not fully vaccinated, when you're traveling from the UK, you have to make a sworn declaration to self-isolate for 7 days when you arrive into France, and then take the PCR test. So I think that's in the whole of Europe, because even
Yeah,
Luxembourg, because I was supposed to travel to Luxembourg beginning of this month of August. But
mm,
you need to self-isolate for 7 days, and but even then, they're not allowing third country nationals into the countries. At least France is allowing people from the UK. And yeah, so traveling in France, yeah, there's a lot of. So I think most countries, it's going to be that case where you either need to be fully vaccinated or you need to have a negative test, PCR or antigen test within the 24 hours. When you enter the country, you might need to isolate. So I think each country has their own restrictions and guidance, but most countries seem to be that you have to isolate, self-isolate. I think most of it has reduced from 14 days to 7 days. And then when you come back into the UK, obviously there's going to be other restrictions. So do make
yeah.
sure. I think so. In traveling in total, it looks like you need like 2 or 3 weeks or month.
I know,
Um,
for a 4 day holiday.
exactly. So
Yeah.
it really seems like a lot. In terms of going for holiday, quarantine, paying for hotels. The
Mm,
expenditures that you're going to have to pay for the testing and for everything else. So it is quite a lot actually.
it
But so
is.
do plan your holidays carefully. You don't want to go into a country and be stuck and not be able to travel and enjoy your destination. I wouldn't want to go into a country and then I'm stuck for like so
Well,
because once you
I
get into
think we should.
you go on.
Uh, sorry.
No, because like what they're saying as well is, so if you're getting to France, you're not fully vaccinated, you have to do the testing, and then when you do the testing there as well, it might be that your test comes out positive, then you're stuck for another, I
Mm.
don't know how many days, 7 days or 14 days, and then you can
That's you.
travel.
That's you finished. Yeah.
Exactly. So it seems so hit and miss, and you can get false positives with the testing, even if you've had orange juice or you've had some other things. People have found ways in which, they've said that if you have this, you can get a positive test. So just be careful and mindful when you're traveling.
Yeah. If I have to go on holiday this summer,
Yeah.
uh, I would probably go to somewhere in Essex or Norfolk or something.
I think
Have a
that's what
great time.
most
Come back
people are
home.
doing. Yeah, like
Yeah.
going down
Yeah.
south.
And
Uh,
there's no wonder that all the places are booked now. You can't get anything.
no, yes,
Fully
because we
booked.
wanted to go to Cornwall and probably down south.
No, I
Yeah,
forgot
so
about Congo. You can't. It's completely booked.
yeah.
Anyway,
So
thank
yeah.
you very much, Dr. Seshni, for joining us this morning with the COVID update. And we'll see you tomorrow,
Yes.
hopefully.
Yes,
Yeah,
definitely. Have a fantastic day. Lots of love
you
from my
too.
family to yours. And stay safe, everyone. Let's spread the love and not the virus.
Fantastic. Right, that
Thank
was
you.